Now for item 10B, presentation of the cost of Medicare Part B premium reimbursement and income-related adjustment amounts, or IRMAA. And we have Ms. Dale Nguyen to make our presentation. Thank you.
Hello, good morning, Commissioners. This is Dale Wong-Win, Assistant General Manager. The staff report before you provides background on the past discussions about the Medicare Part B reimbursement and IRMAAs and how we arrived at the parameters for the cost study. In a moment, Siegel will be presenting the actuarial cost study. Staff recommendation is for LACERS to conduct outreach to solicit feedback from members and stakeholders about the actuarial cost study, as well as related concerns that stakeholders and members may have, and then to package the report and the feedback back to the board in July or August with the results of the outreach that we had conducted. At that time, the board can determine next steps and what to communicate to City Council. If there are no questions at this time, Andy Young from Siegel will present the report.
I see no hands raised, so please proceed, Mr. Siegel.
Okay. Good morning, President.
Mr. Andy Young, I'm so sorry. Oh, Siegel, thank you.
No problem. Thank you, Vice President Lee and other members of the board. My name is Andy Young. I'm joined actually by my colleague, Maggie Ricey, and two other associates who prepared the report. So I will try to put the report on share my screen and put the report so that we can follow through. So please let me know when you can see the copy of the evaluation report.
Andy, do you want to do a full screen on that?
Okay.
View and then go to full screen? There we go. Thank you.
Okay, thank you. All right. So I think you have already received an excellent staff report, although our report is laid out in a slightly different format. So rather than to go through the medical Part B subsidy for the members who are not currently receiving that amount, we go in the opposite direction. We first tackle the costs associated with members who are currently getting both Medicare Part A and Part B subsidies. And in order for us to do the study, the first thing that we have to do is to come up with a level of retirement income that members who are currently married, who's going to be covered under the program. And as you has been indicated in the staff report, in order to determine the level of Medicare Part B, the income-related Medicare Part B premium, we first take into account only the pension benefits that the retirees are receiving from the LACERS program. So in other words, any other incomes that the retirees may be receiving, any other benefits that the members may be receiving outside of the Medicare, of the LACERS program are not included in the subsidy level determinations. So likewise, for members who are married, income from the spouse or domestic partner are also not included in the subsidy calculation amount. So when we look into the level of, we have also been asked by your staff to determine what would be the increase in the cost for the program, for the health program, if the monthly medical, if the Medicare Part B subsidy were to be increased from $170, which is the current monthly amount for 2022, from $2,000 to $238 all the way to $578, depending on the level of income that the retirees are getting from the LACERS program. So there are 5 scenarios we have studied depending on the level of Medicare Part B subsidy, and the amounts are summarized in your staff report, and it also appears on this page of the Siegel report. It varies, depends on the level of Part B subsidy from the increase in the contributions varies from the annual amount of $2.9 million all the way to $5.8 million. As a percent of the payroll cost, it is anywhere from between 0.12% to all the way to 0.25% of pay. In the calculation, we have to make a determination as to estimate as to how much income the member's spouse will be covered, will be the spouse would have. And we have a page in the report which talks about the level, the estimates that we have to put in. In this study, we have made the approximation that if the member were to be married, the spouse would get a pension, which would get an income which is about in total would be 180% of the retirement income that the members will get from the LASERS plan. So this is part A of the study, and again, part of the study there for those retirees who are already getting part A as well as Medicare Part B coverage. In the second part of the study, we deal primarily with a close group of retirees. So these are the retirees who entered the LASERS plan before 1984, and there is a very small group of those individuals, about 1,375. So right now, what is unique about this group of retirees is that they are only getting a health coverage and only getting a dental coverage. None of these retirees are currently eligible for Medicare Part B coverage. So we repeat the study as we have outlined in the part A of the study, except that in this part of the study, we first answer the question as to what would be the cost to provide for the basic Medicare Part B premium. So this is the cost that is provided in the second column on this page. And then we then answer the question as to what would be the additional cost if they were to be entitled to the higher level of Medicare Part B reimbursement based on the level of income. So last but not least, in the last part of the study, we combine the cost for both Part 1, meaning those retirees who are getting both Medicare Part A and Part B coverage, as well as Part 2 of the study, which is for those retirees who are only getting Part B coverage, and the cost, again, are provided on these last two lines of the table and also summarized in the staff report. So bottom line is the cost to provide for the city to enhance the program to provide for the additional Part B coverage would go anywhere from between 0.25% of pay all the way to 0.39% of pay. In dollar terms, we're looking at roughly $5.8 million per year, all the way going to $8.9 million per year. So I think with that, I will turn it back to Vice President Lee and every other commissioners who may have any questions for Siegel.
Yes, are there any questions, commissioners? I don't see any hands raised. I do have a question though. Have we considered a scenario where we're only paying like a fixed rate instead of the full covering the full IRMAA of the member? I think that will make it a lot more simpler.
Yes, so that scenario is in the staff report. That is what we're recommending rather than what we have heard from some of the organizations like our LACI to try and reimburse based on the excess subsidy. For LACER staff from an administrative standpoint, that is really too difficult for us. The way that it is currently is that we do have a Part B reimbursement pot that is separate from your excess subsidy pot. So in this way, if we continue this and we just increase the amount of the reimbursement, if that's what the board chooses or the city council chooses, then that keeps the pots discrete. That means that even if somebody's premium is not covered by their subsidy, they will still get a Part B reimbursement. Currently, they get the basic, and in the future, it could be something more. So that is definitely administratively the easiest thing for us to do. The other method is very complex for us.
Thank you. Commissioner Wilkinson, you have a question?
Yeah, thank you. I just wanted to go and speak in support of the staff report on this and point out that many members, especially the people who are the Part B only, if they were there before the triggering date, which I guess is not 1986, they had no option to go and continue on and to get the A and B coverage. That was a decision made with the city council, and that had great impact on them. And I think that this proposal that would go and pick them up is very important and a very important fairness thing for them. I also want to go and tag upon the comments made by our LACI that the issue here of very high cost of inflation and other things that trigger higher income, that not necessarily a higher standard of living on things such as the triggers of the required minimum distributions that people have and put them into a higher tax rate. And that also costs, in addition to the higher taxes they have, the higher IRMAs. So I think that's very important to take into consideration. And I am supporting the staff report. Thank you.
Thank you. So I hear that you are submitting a motion to accept staff's recommendation to, I'm sorry, Commissioner Chow.
I have a question in terms of in the previous report that staff has submitted, staff had indicated that DWP and San Diego Sarah and CalPERS, they are able to reimburse the Part B IRMAA if there is excess subsidy. How is it that administratively they are handling that? That's my one question. And then my part two to that question is, if it's a fixed amount, you know, currently we always run a sort of like an overage. We have excess. What is that in compared to the cost that Siegel is presenting?
Okay, I'm going to have staff come up to help answer the latter part of the question. I think in terms of the excess subsidy that CalPERS and others might provide, we don't know how they calculate their, make their calculation. However, for LACERS, the calculation to understand what the excess is for each individual requires evaluation of various components of each individual's selection. So for instance, whether or not they had a dependent, which exact plan did they choose? And so it's a very detailed and individualized calculation. And what would happen is that first that calculation needs to be done, and then we need to determine whether there is excess subsidy to be able to apply towards the Part B reimbursement. And this would cause a delay in providing the benefit to the member. And so this is one of our charter mandates to provide timely benefits to our members. That's why for us, that's not feasible.
So currently for the members that are on the Medicare A, B, whatever the plans that they are, we add that on to their monthly pension check as a prepayment for their Medicare, or how is it that they're reimbursed for the monthly premiums that they're paying? Is it on a post basis, on a quarterly basis, or how do they submit the documentation?
Are you talking about the Medicare Part B reimbursement? Oh, sorry, Glenn Malabuick, Senior Benefits Analyst. Commissioner, you were asking about the Part B reimbursement? Or?
Yeah, like how are members getting, do they submit some sort of document and then you reimburse based on the document?
Currently all individuals who are Medicare age and currently enrolled on a Medicare senior plan, we reimburse them the full Part B premium. For this current year, it's $164.90. The previous year is $170.10. And then we're asking individual retirees to submit a copy of their annual Part B statement, in which case we would make an adjustment to that depending on if the amount that they're paying for the Part B reimbursement or for the Medicare Part B premium is lower than the actual amount of the reimbursement that we're giving the individual. In terms of the excess subsidy, as Dale had mentioned, if an individual, let's say they're on a Medicare senior plan and they have the full subsidy amount, they would be fully covered. And then the excess subsidy, what we would end up doing is we would have to evaluate against the under 65 subsidy amount and do the calculation there. So it is, as Dale mentioned, it is quite complex in terms of evaluating the type of Medicare senior plan that they're on, the amount of years that they have that qualify them for the health subsidy that they're eligible for, and then 3, if they're covering a dependent multiple dependents as well.
Oh, okay. I guess, I'm not real familiar with it. Obviously, I'm not on Medicare, so that's why I'm asking these sort of procedural accounting issues. If, let's say, our members are already submitting on an annual basis their year statement, does the IRMAA, is that going to be in the statement already? And then can we just set a cap to that versus a sort of an add-on piece? I guess that's kind of how I like it. If you want to simplify the reimbursement component.
Hello, Karen Frady, Chief Benefits Analyst of Health, Wellness, and Buyback Division. So before we answer that, I do want to address in terms of there's various topics that we're talking about, right? There's the study that we're talking about right now, as well as how do we administer that. And of course, Glenn is here to answer that portion as well. So when we were providing recommendation in terms of how the reimbursement will work, we looked at it administratively in terms of can Siegel conduct a study for the way we're currently reimbursing, and then how will they be able to get the data? Because usually when we're doing a trial study, we get our demographics from our own experience and we provide it to them, and then they make the determination, right? So as Glenn had indicated, there's two parts to it, right? The portion that we actually reimburse the member, it's separate from the subsidy. That's the Medicare Part B. They submit their paperwork and they get reimbursed for that. For the subsidy itself, depending on the member's situation, if you can imagine, if we submit that to Siegel for them to conduct the study, it's very, very complex because in order for us to actually provide that data to Siegel, Glenn's team would have to look at the population and calculate in terms of, okay, what is this what's the age of the member? Is maybe one is over 65, the other was under 65. And then the way you calculate the subsidy for mixed or dual coverage like that, you would have to determine what's the subsidy first for the member, for the entire member, calculate the premium for that, and then take into consideration the benefit for the dependent. And then it depends on the plan that they choose, right? So you have the Anthem, the Kaiser, and the UHC and SCAN. So if you can imagine, for every single member, in order for us to conduct the study, we would have to look at every single member and provide that to Siegel. So that's one part that I would like to explain, and that's how come the recommendation is perhaps it's better if we just, because if we do it like that, it's different from the other plans. The other plans, I can't obviously speak to all of them, but they have a straight calculation with subsidy. And if there's a portion that's, there's a difference, then we believe that that's what they use to reimburse. For lasers, it's different. The structure is different because we reimburse the subsidy separate from the reimbursement separate from the subsidy. So that's the portion. The recommendation then is it's better if we just we focus on the reimbursement. There's currently we're reimbursing at level 1, and then depending on the salary that they're earning at lasers, because we do have the data, it's much easier for Siegel to conduct that study. Otherwise, it would be a drawn-out process because our staff would have to calculate and provide that to Siegel in order for them to make that determination. Hopefully that makes sense. I mean,
So
Clearly, this is a very complicated
it is.
topic. And I'm definitely for the outreach component. I think that there's a lot that we can gain in the outreach effort. I think that we can also outreach to other plans to see how they're administering it, because the IRS code is applicable to everybody. I don't know if we want to lock in the implementation component of this for motion right at this time without getting the information from the outreach effort, because I don't know if it makes sense to say, okay, we will set a set amount for everybody who's IRMAA eligible versus capping it so that anybody who's submitting information falls within can get their reimbursement to the appropriate level. And then at the same time, on an annual basis, we're looking at some premium savings. Like every year that's going to be different, so I don't know based on year to year, how is that going to be actuarially neutral for the year study? So there's a lot of parts to this that I don't necessarily want to make a decision today on, but I'm definitely for the outreach piece, and I'm for what it sounds like the other members of our board is, which is to make sure that our members are taken care of, especially those that are in the ranges that are pre all of this Plan B, all of that stuff, where they're very vulnerable to any kind of moderate changes in CPI. And of course, health premium is a huge component of that.
Neil?
Thank you, commissioners. Great questions. What I would say, a couple of things. One is that Lacers wants to ensure that if the benefit were to be improved for our members going forward, that it'd be something that we could actually administer without it being overly burdensome or complicated for the members or take additional time or lead to so many calculations there could be errors there. So the current structure that we have right now is that for those members that are Parts A and B in Medicare, we are representing the specific dollar amount that's tied to the that basic cost, that 164 and change, right? It was over 170 before, and that number will probably change going forward. Then for each level of the IRMAA, there's a specific dollar amount. It's separate from the rest of the premium and the subsidy and how that's looked at for the members. When we've looked at very, very few other plans across the United States reimburse anything on the IRMAAs. Very, very few. For water and power, my understanding at least is that to the extent that there's money left over, it could be applied towards that basic Part B cost, and if there's anything remaining, it might go towards some of the IRMAAs. But that really is dependent upon each member's situation. They may not have any subsidy to apply even to the Part B only, that first Part B basic, I should say. Well, for our members, it's called out specifically in the ad code, and it's reimbursed regardless of whether or not there's any subsidy left over. So that is a benefit I think our members have that is different from others. But I would stress that at this point in time, we just wanted to share the analysis from Siegel and to get the board's direction about doing what we think is very important outreach to our membership and stakeholders. And our LACI is one of those great organizations. And then incorporating their voice and what they're seeking. And then that'll be part of our staff report that will come back to the board within the next 6 to 8 weeks. And then as part of that, we can have further options for the board to consider. Ultimately, of course, it'll be up to the board to determine whether or not they want to send something forward to the city. And then it's really up to the city to make that determination whether or not they would improve the benefit for our members. We think there's merit to it. And even if it's not a whole lot of plans out there in the United States that are doing it currently, doesn't mean that it's not something worth looking into.
Commissioner Sidley?
Yes, sorry.
Go ahead.
Neil, thank you for that. And Commissioner Chow, thank you for your thoughts. I want to push back just a little bit on that I'm afraid the administration costs would eat into ultimately the benefits that we're able to provide. Otherwise, we're going to have to hire more staff. If I'm hearing correctly what you're saying, and everybody would have to turn in information versus we sort of make assumptions. I think that the system will never be perfect, but we are trying to provide a benefit for our members, and we may have to make some compromises to not overly complicate or put in too much administrative burden. So I am one to suggest that we actually try to make these assumptions and not do it on an individualized basis, because I do think that we'll end up spending more on that process than we will to try to, provide a benefit that we want to provide. So not that Commissioner Chow's point is not well taken. I just think that the perfect might be the enemy of the good on this. And so I would be more of an advocate of assumptions versus individualized payments.
Thank you so much, Commissioner Sidley. Well said. Commissioner Wilkinson?
Yes, thank you. I just want to jump in on one area here that I know will be touched upon by staff and Siegel as this thing goes forward, assuming that, again, the plan is to go forward, is how high the funded ratio is of this. And even on the most, I suppose, generous of the assumptions here, the scenarios, scenario 5, it still results with a 95.55% funded ratio, which I think is absolutely amazing. And I think that everybody part of this thing and staff that's done that should take good credit for that. And the fact that this plan has been pre-funding health back from not quite the dawn of time, but close to that. How many years were we talking? Decades at least, right, Neil?
Yeah, we're more than 2 decades, probably going closer to 3 decades.
Right. So I think that while this is an ask and it's something to the mayor and the city council, the point is that this plan is extremely well funded and is a much better position than I think most plans in the country would be if presented a similar challenge. So thank you.
Thank you. Commissioners, any other questions? I want to thank staff who has worked so hard on this for so long, and Glenn, Karen, Dale, and your numerous other staff who has put so much effort and time. I really appreciate the work that you've done. It is a really, really complex issue. And as we've covered this for the several months and, maybe back a year ago. So Commissioner Sidley, do you have a comment?
Well, it just, on the agenda, it says possible board action. Are you expecting a vote from us?
Yes,
there
to
is-
provide direction to us on the outreach program, but that's
Okay.
the board.
All right, just wanted to clarify.
Commissioner Sidley?
I would move to go with the recommendation of the staff.
Do I have a second?
Second.
Second, Commissioner
You actually
Wilkins.
had already moved. Yeah,
Yeah,
okay.
thank you. So all those in favor say aye.
Aye.
And
Aye.
all those who oppose say nay. Hearing none, the motion carries. Thank you very much again.
Thank you.